Thank you for coming to this video. My name is Greg Vigorin. I practiced dentistry, restorative dentistry, for the last 50 years here in Newport Beach. And over that time, I got the curiosity of 10 cats and the control mechanism of an Irish setter. And so I've met a lot of people, and I want to introduce you to Darryl Bates.
Thank you. So my name is Dr. Darryl Bates. I'm a physician, and I've been practicing medicine, but in a different way compared to most physicians. While I was at UCLA Medical School, I realized early on that the medical education was excellent, but it was really focused on pharmaceuticals and surgery. And I was very disappointed that we weren't really focusing on exercise and nutrition and prevention. And so immediately after UCLA Medical School, I took a year off, and then I enrolled in Chinese medical school. And so I had this back-to-back experience with conventional medicine and with Eastern medicine. And it was Chinese medicine that really kept me in medicine, because I got to see what holistic thinking really was. And I didn't realize at the time, but I was a holistic thinker as I was going through UCLA medical school. So fast forward, after practicing acupuncture and herbs, I decided to go back into conventional medicine. And so I got board certified in family medicine as well as sports medicine. And my whole focus has always been on holism and now what we call regenerative medicine. And so that's my background.
Yeah, and I'd like to interject here that we've been, between dentistry and medicine, we both have a different philosophy, and that different philosophy is we don't want to just treat symptoms. We want to look for root causes, causation, foundational concepts that can heal people or make people healthier without pharmacology or surgery. And what I was going to say about your approach is even though you do stem cells and exosomes and Wharton's jelly and peptides, you don't just put those on top of an open wound. You try to get the patient in the best condition to have those modalities be successful. And I call that a synergy. I kind of explain it like if you were a Formula One driver, you wouldn't want a mechanic that only had one tool.
Right.
You'd need a whole garage if you wanted to compete. And we have gotten so myopic in our billing cycles, and we are almost controlled by medical or dental reimbursements and codes that we've lost track of the patient's health. And so, and I know you espouse these really kind of a ethical, moralistic approach that you know, how would I treat my own family? How would I treat my mother, my father, my brother, my wife? And you don't just want symptomatic relief, you want better health. And so why don't you go into some of the things that you do before you take off the top shelf very expensive regenerative techniques, which work, by the way, but they work much better if you understand what's
Right.
below the top shelf.
Right.
Does that make sense?
Oh, completely. Yeah. So, you know, and before we jump into that, I do need to say there is a time and a place for conventional medicine.
I agree with you.
So the areas that I was most interested in going through medical school was emergency medicine and trauma surgery. Mm-hmm. And I also liked a bunch of other things as well. So if you get hit by a bus, the first place you need to go is the emergency room.
Right.
If you've got a broken bone that needs to be set and needs to be placed, and maybe you need hardware, you need to go to a trauma orthopedic surgeon. So
or a neurosurgeon or a vascular surgeon, or you know,
Yes.
somebody that really knows their stuff.
Yes. But the three places for conventional medicine that really are very powerful is the emergency room, it's the ICU, and it's the surgical suite.
And to put that into place, what I've always said about medicine, conventional medicine and non-conventional medicine is that there's both substance there, just like there's substance in 4,000-year-old Chinese medicine and Korean medicine and Japanese medicine and Indian medicine. They all have a basis that works, but you use critical thinking skills and common sense to separate the baby from the bathwater.
Yes.
And you don't need to drink the bathwater.
Yeah.
Okay? And so to use all these tools synergistically, what you were discussing with emergency rooms and ICUs and surgical suites, in those three areas, you see the results or outcomes immediately.
Yes.
You can't BS survival in what I call battlefield medicine.
Mm-hmm.
Okay, you learn what works and what doesn't work really quickly by survival. But in chronic conditions, degenerative conditions, inflammatory conditions, metabolic conditions, it's not about using one screwdriver for the Formula One car.
No.
It's understanding all this and integrating it. And that's one of the things that sparked our interest in each other. I think I'm trying to do the same things in dentistry preventatively so that I don't have to do expensive difficult reconstructive procedures.
Right.
If we can prevent it at the get-go, and if you can prevent disease at the foundational things, you save people a lifetime of disease
Right.
and suffering. And so back to what I asked you earlier, what are the things that you would like to see that make sense, that are from medicine, that truly work before you go to the top shelf and try the most innovative and expensive treatments
Right.
that are available?
First and foremost, people need to focus on the basics. People need to focus on the foundations of health. Most everyone knows what they are. It's just conventional medicine has kind of put them to the wayside. So when I say the foundations, nutrition, we literally are what we eat. Hydration, which is something that you're experimenting with now. We need to make sure that we're sleeping well. We need to make sure that we're managing our stress. And we also need to make sure that we are part of our community, that we are contributing, that we are feeling that we are part of something that's greater than just ourselves. So usually when people have taken care of this, or they come back to it after having some illness, that's when it's much easier to then add the regenerative aspects.
Well, you're talking about having a spiritual or a religious or a community motivation that you're helping people, and that's one of the things that I see in you. But we also, when people talk about sleep, people don't define it very well, and people don't diagnose it or treat it very well. We're talking about nutrition. Mediterranean diet doesn't explain a lot. We're talking about portion control and timing on eating. We're talking about sunshine and blue light and early morning, resetting of the circadian clock. These are all things that are absolutely confusing to the average person.
Right.
But if they just tell you need to exercise and you don't have a good program, people just get injured.
Mm-hmm.
You can take all kinds of supplements and you might be taking 10 times the amount you need and missing the one that you
Right.
that you actually need. And so there's a tremendous amount of diagnosis and global understanding of systems and mechanisms and biologic processes that I think we're starting to really explore. And you are one of the leaders in this. So hit me up for what the below the.
So what's great is there's a test that LabCorp developed with the NIH.
By the way, LabCorp is right on my floor down the hall.
Oh, okay.
Yeah.
I mean, they're everywhere. They're the largest global lab company in the world. And so they've actually patented this test. They're the only ones that offer it. And what's incredible about this test, it's called MVX+. M is in Mary, V is in Victor. X is in X-ray.
Yeah, X is in MV
MVX, and it stands for Metabolic Vulnerability Index.
Okay.
So Metabolic Vulnerability Index. And what this test does is it actually looks at your fundamental physiology and biochemistry, yours individually. Because
Correct.
we're all individuals. As great as medicine has been with population studies, what it really comes down to is an N of 1, and that's you, right? So it doesn't matter how a medication affects me, it's how the medication affects you. It's how the supplements affects you.
The N of 1 has always been the most important N.
Yes.
Yeah.
And so when we go back to nutrition, the reason I'm kind of general about it is there is no one diet that's best for everyone. You, in fact, might need different nutrients in your 20s compared to your 40s compared to your 60s. You might have an unfortunate or unlucky exposure to something environmental or something that's bacterial or viral. That might actually change your biochemistry for a certain amount of time. It might change your physiology. So what's great about this test is you get this test and it actually gives you a score. It gives you a score for your health from 1 to 100. The lower the score, the better. And what I've been seeing is as these scores are coming back, most people's scores are higher than what they thought it would have been. And so you get your score, it's going to focus and tell you, because there's six clinical factors that are measured. There's 3 indices that are created from those 6 factors. So now you're able to look at, is your organism experiencing inflammation or an infection that you may or may not known about? What is your nutritional status? Are you malnourished based on these indices? And then once you take this, the other one is your inflammatory score. So we know that a lot of chronic diseases, the basis is inflammation. A lot of the diagnoses that people get, whether they're an allergy diagnosis, whether it's an autoimmune diagnosis, what it really is just a description of what the person is experiencing. The underlying cause never really gets addressed. And we know that a lot of the underlying cause has to do with inflammation.
Right.
So what's great about this test is it allows you to get to the root cause. So often with conventional medicine, what conventional medicine does is conventional medicine focuses on the symptoms. It suppresses or it stops the symptoms. Now that's great as far as making you feel better, but it's never addressing the root cause, so you don't need to have the symptoms to begin with. And if the root cause isn't addressed, you're going to have other symptoms pop up in different parts of your body or of your brain. And the worst case scenario is you suppress the symptoms and you get something worse that comes down the line, whether it's a year, 5, or 10. So with this test, what I'm really excited about is it allows us to not only help the person with the symptoms, but it allows us to see what the causes are and then also what the mechanisms are.
Also, to get people to make change, the person that they care the most about is themselves.
Yeah.
And you have to be able to see change, positive change, to really stay on the right path.
To stay the course, you need to have data. So if you've got a number, and let's say your number is 55, and I'm telling you, hey, we need to get you down into the 30s, you've got something concrete that you can focus on now. You can say, oh, I'm at 55, I'm going to do X, Y, Z, I'm going to do what Dr. Bates told me to do, and then we're going to be able to actually test it.
And the important thing is then the patient, the client, can come back, redo the test, and see that they're moving in the right direction.
Yes, yes.
Okay.
And
that positive feedback is very important
excellent
for staying on the course.
Yes. And this works both ways, because you can also take this test, go to your conventional medicine doctor, do whatever their treatment is, wait 4 to 6 weeks, repeat the test, and see, is this helping you? Because if the needle didn't move, you know that all you're doing is managing symptoms.
Or it moved in the wrong direction.
It could have been. Yeah. So I would love to get my hands on this test. Apparently, Duke did a study with this test with a lot of participants testing a statin. And this MVX plus test with what they were using with the statins didn't budge. And they didn't publish the study.
Oh, if it doesn't pay for somebody else's income, it gets buried.
Right. And a lot of people, unfortunately, don't know that the science is biased. You would think that if a study was done and it actually was detrimental or it showed that people didn't improve, that would be important data to share. But the way that conventional medicine works, if whatever studies they have paid for, if it doesn't fit their narrative, it'll never be published.
That's not conventional medicine. That's conventional funding.
Okay.
Okay, because you can publish a study. It's just you won't get any more funding because they all talk to each other. They say, "No, God, don't use that doctor. He killed a $1 billion drug with one study." Yeah.
This knife cuts both ways. So I am very critical of conventional medicine when it comes to chronic illness.
Correct.
But I'm also critical of alternative or complementary certain aspects of regenerative medicine because I feel like there's a bunch of people out there just trying to make a quick buck and they're not really practicing good medicine. So this comes back to, I call it preparing the soil. What is so important before people jump into really expensive regenerative medicine techniques, they deal with the basics first. Because if you deal with the basics first, with the fundamentals.
Take all the lead weights off their back before you ask them to run 100 yards.
Yes. Yeah. And then when we add, whether it's exosomes, stem cells, peptides, PRP, now we've prepared the soil so that these techniques are going to stick. You're going to have a better chance of having the regeneration and the rejuvenation of the tissues rather than someone coming in, they've been polluting themselves by smoking and having McDonald's all of the time, and now they're going to pay $5,000, $10,000, $20,000 for regenerative treatment, but they're still going to go back and smoke and have McDonald's and Diet Coke.
And they're going to complain that it didn't work.
Yes.
And in the wrong hands, it doesn't work.
Right.
And in the wrong soil, you don't grow a healthy plant.
Exactly.
Okay.
Exactly.
No. This got more to do with Formula One racing than I realized. You have to look at everything and do everything that you can. Lance Armstrong was one of the greatest athletes of our era. He pulled out all the stops. There wasn't anything that was too small to not consider. Mm-hmm. And he just did more. And I think Brady did the same thing. He did everything possible to be the best athlete that he could and to last longer than anybody else thought he could.
Right.
New subject. Come on, come up with something. What else you want to tell me? No. So the integration of Aruvic and Chinese and Asian medicine into Western medicine, and there are some unbelievable surgical procedures, and if you do get hit by a bus, you want the people that were battlefield trained. And by the way, that's where most of our emergency medicine came from. You blow people up and you shoot people. You got to be able to do stuff quick.
Yes.
And that is that's my highest regard in medicine, is for those people that work in those areas. But family medicine and pediatrics and all the other specialties are important, especially when they're integrated.
Yes.
But when people myopically only look at their area and they become smarter and smarter in their area and stupider in the next silo, I call it hubris. And the other thing is things are always changing. My dean of my dental school, almost 60 years ago, came in and told our class that 50% of what you're going to learn is going to be wrong or correct for the wrong reason. But he said you had to learn it all. Well, being the heretic that I am, and by the way, you're a heretic also, being the heretic that I was, I said, well, then I'm not going to miss my health and recreation and movies and dating. You know, I'm a young college student.
Right. Yeah,
Why
fun.
would I sacrifice my youth, to learn 50% of information that's wrong? And I just said, well, I'm going to keep my ear to the ground and see when things change and make changes quickly, because I'm not set in concrete in what I learned that gave me my degree or my, quote, prestige in my profession. I'm going to look for the best thing for my family, the best thing for my patients. And I'm going to change when I get new information
Right.
that I think is valuable. And I still will make mistakes, but I will change much quicker and open up to things much quicker than if I'm rigid. I'd rather
Right.
be the bleeding edge leader in the field than the last one to
Yep.
do something. And the other thing, and you talked about it, is so much of this new stuff that's coming out is turning into a marketing ploy, where people, I've had orthopedic surgeons for years that were patients that I said, you really should get people to physical therapy before you do these orthopedic projects, knees and hips and shoulders and things, because they're going to recover much faster.
Yeah.
They'll and you can go afterwards. And then when stem cells and some of the regenerative stuff came out, I said, you really got to look into it. He says, no, we just do what we do. Well, he finally retired, and he says, yeah, this stuff is really good. You got to do this. You got to do this. But he couldn't make the leap when he was still doing the procedures out of order for the patient's best interest.
Right.
Does that make sense?
Right. Right.
Yeah.
Yeah. And so you said some really important things. So one is being open-minded enough to be able to accept new information.
That's correct.
So that is what true science is. True science is when you get new data, does it fit into your model or into your map? And if it doesn't, it means you need to find a new map, or you need to expand.
That's correct.
Right? And so for me, Chinese medicine, the Eastern models are much more expansive than the small, microscopic, only focused on structure, conventional medicine model. And this is where the gap exists. With chronic disease, what we're finding is conventional medicine is not able to keep up. Conventional medicine is sticking to these old models that we see do not work. So classic example is you still have all of these cardiologists, all of these internal medicine doctors and family medicine doctors that are pushing statins because they've been told cholesterol is the boogeyman. Cholesterol is the problem. But what we see statistically is it's a flip of a coin, whether or not your cholesterol is high or low if you're going to have a heart attack or a stroke. There is no correlation with cholesterol and heart attacks. There's no correlation between cholesterol and stroke. So the map, the model has to be expanded. There's something else that's going on there.
And if I can interject, I can tell you that ventilation when you sleep is one of the, probably the number one trigger for a lot of these events that is just completely overlooked. And vascular lining, the
endothelium.
The endothelium, the glycocalyx in the endothelium, and you have a machine that can actually evaluate.
Oh, I don't have that one yet. No.
You don't have that? Well, but it's coming out.
Yes.
And you can actually look at the health of the slippery substance that lines every single vascular from arteries down to capillaries to veins. And it's the same slippery substance that's on the scales of fish that makes them slippery. And that's one of the best markers of your health.
Yes.
And when you lose that lining, it's all 1 micron thick, you're at risk for vascular disease.
Yes.
And it's reversible.
Yes.
And I can't tell you how many people who should know about that don't have a clue.
Well, so this also goes back to how influential and dominant the health insurance companies are. So if something isn't patentable, then oftentimes it's not going to be offered through insurance. And so what you just said, that science about the glycocalyx, that's been known for years. But is it in medical schools? Is it being taught? Is it being taught to residents? No. Oftentimes, the science that comes out, it'll take 15 to 20 years to be taught in the medical schools.
Well, that's one of the things, you know, I mean, I say most of my discoveries are turnip truck discoveries. A turnip truck comes to town and this dumb kid falls off and I turn around and, how'd you get here? I fell off the turnip truck. But and I've always said that when there is something that has validity that I hear about, it's 10 or 20 years later until everybody says, I will have arguments with people in the beginning, and they'll say, well, there's no science, there's no publication, there's no research to support that. And, you know, and I have to look at them with, huh? And then 15 or 20 years later, that same person will say, well, we've always known that. and it's because you can't monetize some breakthroughs in information. And as a matter of fact, those breakthroughs in information actually compromise the billing cycles of people who have monetized their education to do this procedure.
Yes.
Well, that procedure doesn't work and it's old and the outcomes are terrible compared to other things, but it'll be 15 years before people stop doing that.
Right.
After everybody knows.
Right. And I think it's going to happen a lot faster than we think. So
I'm hoping.
So a couple examples. One is...
That's part of the reason we're making this video.
So one example, in Japan, I don't know exactly what the surgeries are limited to, but they have certain knee surgeries now that only robots are doing. There's no humans involved. Mm-hmm. That's because you can set the parameters. The robot isn't going to show up drunk. It's not going to hit on the nurses. It's not going to cut the wrong knee. It's not going to complain about the alights. It's only going to do what it's programmed to do.
Right.
Another example is there is now a artificial blood product that works for every single blood type and it's shelf stable. So the way that, especially with AI, the way that medicine is moving, at some point, what's going to happen is the people that are involved in medicine that are technicians will more than likely be replaced. The people that are critical thinkers and holistic thinkers are going to have a place in the future because they've been problem solving and they've been critically thinking about the entire organism, about the person. Not only the symptoms, but where are these symptoms coming from? One of the things that I'm so surprised about, even to this day, is when someone has a knee injury or a hip or a shoulder, why does the provider not ask, well, why didn't it happen to the other side? They never take the next step. They never ask that question. And so I'm oftentimes seeing people who have already been to see an orthopod or they've already been to see a specialist, either had surgery and weren't satisfied or they don't want the surgery. So when I ask that question of them, sometimes they're blown away or they go, you know what, I thought the same thing, but no one else has asked me that. So sometimes it really just takes thinking of the next step, thinking of the person as someone who's living in a community, living in an environment. If you hurt your left hip, well, how come your right hip is fine? Or is your right hip at risk for what happened with your left hip? Because we want to be able to prevent that. So I do think things are changing, but a lot of this is also going to take for just the average person to start asking questions and demanding better.
Well, that's what changes healthcare is when the patients go somewhere else, then the traditional doctors say, I better put this in my toolkit. I'm losing too many patients. I have to offer it. And we found that with regenerative medicine. A lot of the conventional doctors said, we offer that now. But when you would come in, they'd say, well, that doesn't apply to you. We got to do the old
Right.
cut and replace.
Yeah, it's kind of a bait and switch. And really, one of the only reasons that they're doing that is because they're seeing how much money is being spent somewhere else.
That's right.
Like, one of the things that people don't realize is when you are involved in health insurance, you are a captive audience. A lot of the doctors that are in these large, clinic chains and in these hospital systems, they haven't had to improve because they just get patients sent to them day in and day out. If they were in the free marketplace, and if people actually had a choice where they wanted to go, then you would see what true capitalism is.
Well, we've also seen doctors that were trying to integrate this into the traditional that were asked to leave the hospital.
Yes.
Or were asked to leave the group.
Yes.
Because you're giving us a bad reputation with better results, and you're cutting down on our revenues in these areas. But there are two real quick stories.
Yeah.
In Australia, 50 years ago, I had low back problems, and I brought Robin McKenzie, who wrote Treat Your Own Back, Treat Your Own Neck, and he's considered one of the top physical therapists in the whole world. Now I don't know if he's even still alive, but in New Zealand, you couldn't get to see an orthopedic until you got a referral from a physical therapist.
Interesting.
Okay.
It's flipped.
It's flipped. And that's just one of the analogies that where you see we sometimes have to rearrange things from what we're used to.
You had mentioned before, we talked a little bit about specialties, what has been known for decades. So I went to medical school in the 90s, and they were telling us this back then. They were telling us that there's not enough primary care docs, and they already knew back then that the best, most efficient, highest form of medicine was training primary care doctors to have extensive knowledge in most of the specialties. So being good at the bread and butter and being able to manage those, but also knowing when they needed to refer to a specialist, because it cut down on cost. It allowed someone to basically come into one clinic and for 80+% of the issues to be managed in that one primary care office.
By one doctor who knew who you were.
Exactly. And not only knew who you were, but knew who your family was. Right. So when I was going through, I delivered so many babies that I was seeing these kids grow up, over the couple years. I was around the parents, and I was also around the grandparents. So, and I even made home visits, which, who does that now, right? So I still have in my mind, I'm going to date myself, the Marcus Welby MDs of the world, right?
That's who saw me when I was a child. This doctor came in with his black bag. And I, having been in dentistry for 50 years now, I've seen families where I've treated the new children that then became parents, then became grandparents.
Yeah.
I'm treating the grandparents of the children that I started with. And when we use this concept on early intervention, my 3 children who cumulatively have 118 years having their teeth and 84 teeth, 1 dental procedure.
That's incredible.
And I didn't, it was a turnip truck discovery. I didn't know that I was preventing all this stuff by intervening early with a concept that still is not practiced today.
And it should be.
Oh,
right.
That's my goal of being on
right. But part of the challenge.
We'll do a whole program on that.
Okay. But part of the challenge is what you, how you practice and what you teach threatens the insurance model, right? Because if you are able to prevent, then that means that people don't necessarily have to use these higher priced or more invasive procedures later on down the line.
It also threatens the political hierarchy of knowledge. In other words, you get your knowledge from somebody that's above you, and you don't get knowledge from somebody below you. So you always go to the mountain, and the trouble is the mountain's getting old and doesn't have all the new stuff.
Right, right, right,
Yeah.
right. So part of where I am starting up this practice, so I'm in Pacific Beach in San Diego, but I'm also creating a practice that is virtual, that's online, so I have more of a reach. But I've always been involved in education. And so I'm educating my neighbors, I'm educating the people that come into the practice. Particularly with this MVX Plus test, I'm going to be able to educate a lot of folks because they're going to learn about their body. They're going to have the immediate feedback of being able to retake this test whenever they want.
Right.
I mean, finally, there's a test that measures your health instead of focusing just on disease.
Well, this has been absolutely great. I hope we can make this a regular thing until we talk each other out. Because sharing new information that's valuable for making decisions and your health, and not just living longer, but living healthier longer.
Yeah.
And that's health span.
Yeah.
And health span is actually more critical than lifespan, because nobody wants to get old and be sick and infirmed and dementia and arthritis and crippled and diabetes and on dialysis. I want to go to 120 and
You want to be skiing.
yeah, and be good night that night, and the next morning all my family's coming in and say, "You had a great run, Papa." Okay?
Yeah, yeah.
All right. Thank you very much. Again, my name is Greg Vigorin, Newport Beach, and we will also be expanding our teledentistry and trying to give people, how to find a dentist that gets better outcomes than the norm. And you're moving into telehealth, and I think that's the future.
Yeah.
It's going to be education and better choices. So thank you very much. Go to my website or Dr. Bates' website, and just keep us in mind. Talk to your friends. Thank you.